Hello, I'm Dr. Catherine Toomer, and I am a family medicine and community health physician and founder of Total Weight Care Institute. I also am the creator of Total Wellness and Weight Health programs as well. I have been using GLP-1 medications for treatment for diabetes and off-label for weight loss, or I should say, for treating the causes of weight gain, for over 10 years now. And so I feel like I'm an expert in the area. And so people who ask questions, I like to answer them. So one of the questions I often get is, if I start this medication, will I have to stay on it for the rest of my life? And there really is no way of knowing. It depends on what it's being treated, how much it's using the medication for treatment, and then what happens once the treatment is started. So, what GLP-1s do is they help with glucose dysregulation. Glucose dysregulation is what causes much of what we see in weight gain. It's insulin resistance, pre-diabetes, diabetes, all on the same continuum. And so what happens when your blood sugars go up, your insulin level goes up. Your insulin then drives the food you eat into making fat rather than into making fuel. This is very common in most people who have difficulty losing weight, but find it very easy to gain weight. And it's a genetic component to it. It's often based on your family history. And so when that is the case, when someone has chronic weight gain issues, whether just from being overweight or for being obese. It doesn't have to be obesity only. Then these medications work to prevent the biopsychosocial reason for their weight gain. So it prevents the biological glucose dysregulation. It acts on the brain to suppress appetite. It also acts on the brain to stop cravings. That's the food noise that people talk about. And then it acts on the GI tract, and that's the only mechanical part of this process. It does slow down gut motility. So that is the part that if someone doesn't have glucose dysregulation and they lose some weight on a GLP-1, it's because of the ability to, or it's because they get full faster because of the gut slowing of the gut motility. However, that's a temporary side effect, and so it will stop eventually. And so it doesn't affect appetite or hunger centers or anything else. So when it suppresses appetite, it's because the brain is genetically predisposed to take blood sugars and drive appetite. And that's why it works so well. So often, what happens when taking these medications, yes, the causes of weight gain are treated, and so therefore weight loss occurs. This is chronic. It's like having migraines. It's like having diabetes, hypertension, hypothyroidism. They're all, it's part of the chronic disease. Con, I don't know what the word, group of diseases. And so when it's being treated, there's a few things that happen. So the GLP-1 then helps the body maximize its fuel production. So instead of shifting the food towards making fat, now food is being shifted towards making fuel. So now muscles are no longer competing with another metabolic process in order to be active, in order to keep your metabolic rate up. And so what happens then is that when you build muscle, it becomes the driving force of your body. How much you're able to do that will determine what happens to the medication later. For some people, if they're lower on the diabetic continuum, they're way down in the insulin resistant category, and they build muscle, that muscle may be able to take over completely for the medication. Their body may reset and they no longer need the medication. Other people may need a little bit, either less of a dose or a dose taken less frequently. But that is where the art of medicine comes in, because it's different for every single person. And it takes time sometimes to figure out what the frequency and what the dose should be. So when the question is asked, will I have to stay on this for the rest of my life? It really just depends on how much your body will then depend on the medication later. So again, I'm Dr. Catherine Toomer. I am a family medicine and community health physician. And if you have questions, you can ask me. on the comments of this video, or you can send me questions at admin@totalweightloss.com or courage@drtumor.com, or you can just find me on any of my social media platforms and ask me questions then or there. All right. Have a good day, and I hope this explains why it is that these medications work so well.